Dear colleagues, good afternoon and thank you for joining the 21st Task Force meeting. I am delighted to be part of this hybrid event. Thank you to IAEA for hosting the meeting. IAEA has always been one of the leading agencies of the Task Force. When the Director General provided his remarks a few weeks ago at the Friends of the Task Force meeting during the high-level week of the UN General Assembly, he highlighted the considerable achievements of the Task Force. But equally, and more importantly, he reminded us that there is no room for complacency. Dr. Tedros reminded us that a lot more needs to be done if the task force is to meet the demand for technical assistance to drive whole of society action. A lot more if the task force is to mobilize the necessary political and financial resources for governments to deliver on their commitments, including through the Health for Life Fund. I am therefore pleased that the Task Force Secretariat has been able to mobilize some initial funds to undertake an independent evaluation. We need this to understand where we are doing well as where we need to do better. We will have a chance to review some draft terms of reference during the meeting, but as this is an evaluation of our collective work, I would really encourage members of the task force to make a contribution to funding this evaluation. Like many of you, I participated in the high-level week of the UN General Assembly. You will be aware that 3 political declarations were agreed, one on pandemic prevention, one on tuberculosis, and one on universal health coverage. I am pleased that in the agenda we have space for a discussion on the UHC political declaration, which importantly highlights the magnitude of NCDs and mental health, underscores the need to work coherently across government sectors and to engage partners across programmatic areas, emphasizes legislative, regulatory and fiscal action, all of which of course require our collective action to deliver, reaffirms the political declarations adopted at the high-level meetings of the General Assembly on the prevention and control of NCDs, and looks forward to the convening of the 2025 high-level meeting on NCDs. 2025 will be upon us very shortly, and so we need to develop our collective vision on what success looks like at the high-level meeting and the political declaration soon. I hope that we will be able to have some of these discussions this week. The agenda that we have in front of us is, as always, a busy one. We will review where we are across the full range of joint programs, thematic groups, and country missions. I also look forward to feedback from UNICEF, UNDP, and WHO on outcomes from New York with regards the Health for Life Fund. I am especially pleased that we will be having a special session on human rights. The Human Rights Group has made significant progress in the last year under CHR's leadership, and I was pleased to hear that the Task Force Secretariat and UNICEF briefed the Committee on the Rights of the Child last month. The Task Force Secretariat and Convention Secretariat will be doing a further briefing to the Committee on Economic, Social and Cultural Rights this month. As you know, a human rights-based approach is central to the Global NCD Action Plan, previous NCD political declarations, and was again repeatedly highlighted in last month's political declaration on UHC. I was also pleased that the Task Force Secretariat and a number of its members contributed to the successful session on promoting health and well-being in an urbanizing world during the UN Habitat General Assembly in June. I look forward to discussing how to take the key areas that emerge from that meeting forward. Similarly, I look forward to hearing the plans of the task force to support action on NCDs in small island developing states following the June ministerial in Barbados. So, A lot to cover, no time to waste. Thank you again to IAEA for hosting us.